Good morning, my name is Lorna Brokenshire-Dyke. This is an assignment for my Biomechanics and Gait Evaluation module. Today I will be giving a presentation about the biomechanics of equine laminitis. I will start my presentation by recapping the condition of laminitis, what it is, briefly its etiology and typical clinical presentation. We'll then look more closely at the biomechanics of the equine foot, both at stance and at walk, which is at the heart of understanding how this condition affects gait. We will then look at the biomechanics of failure of the foot before discussing the clinical implications of biomechanical theory, specifically reducing breakover, supporting the foot and raising the heel. I'll finish by summarising my conclusions and presenting my references. Laminitis is a common, incredibly painful and potentially devastating condition of the equine hoof. Its name literally means inflammation of the laminae, and it is a disease which affects the epidermal and dermal lamellae of the inner hoof. Histologically, we can see epidermal lamellar necrosis with basement membrane separation and dysplastic regeneration corresponding to the lamellar wedge which drives the epidermal and dermal laminae apart and leads to structural change and mechanical failure. Etiology of the condition falls into three main groups. Endocrinopathy, which includes glucocorticoid-associated laminitis and insulin-associated laminitis. Inflammatory, which includes endotoxemia, pneumonia, retained placenta and ischemic colic. And mechanical, which includes overload and trauma. It is commonly seen in overweight ponies linked with dietary indiscretion, but it can occur in any age, breed or sex. The classic stance of the acutely affected horse is a patient that prefers to stand in one place, continually shifting its weight from one foot to another. The horse's front feet and sometimes the hind feet are set ahead cranially compared to the normal stance. In severe forelimb laminitis, the posture is considered pathognomonic, as in the photo here. Affected horses display a slow, stilted gait with short strides and decreased protraction. So what are the patient factors that affect biomechanics? Well, at all times it must be remembered that what the horse is trying to achieve with its gait adaptations. Laminitic horses will strive to minimise the load on the most painful limb or limbs. This will necessarily increase the load on the other limbs or cause the horse to lie down for longer periods. In general, the more exaggerated the lameness is, the more severe is the disease. The fine detail of any gait adaptations will be affected by severity, whether forelimb, hind limb or both, chronicity, mechanical changes to the pedal bone and hoof unit, and the effectiveness of any pain management strategies. The foot is inherently strong with multiple levels of components that contribute to it, including inherent physical and biomechanical properties, microarchitecture, and the interaction of the foot's components. However, it needs to withstand large forces. Each forefoot needs to support 30% of the horse's body weight at rest, double this when one limb is off the ground, and up to 150% of body weight at the gallop. The lamellar junction acts as a sling for the distal phalanx, and the laminae are loaded in a combination of shear and tension forces. The joint force is the body weight of the horse exerted down onto the distal phalanx. Superimposed on this is the tension in the deep digital flexor tendon, which produces a flexor moment arm about the distal interphalangeal joint. These forces are balanced by the surface traction of the lamellar junction and the ground reaction force exerting pressure on the hoof via the wall and or the sole. A seconds moment arm, an extensor moment, is created due to the misalignment of the joint force acting through the centre of rotation, which at stance is caudal to the opposing ground reaction force acting through the centre of pressure. At stance, these combined forces are equal and opposite. But when the horse walks, there is a dynamic state. The magnitude, direction and centre of pressure change with the phase of the stride. The flexor and extensor moments about the distal interphalangeal joints are also dynamic during movement. the forces are significant. The flexor tension of the DDFT is estimated to be in the range of 3.8 newtons per kilogram at walk. In the sound horse, we know that the forelimbs bear 58% of the horse's body weight and that they also have to withstand the additional demands of the movement of a heavy head and neck. In Laminitics, movement is moderated to minimise pain. Horses will preferentially load the least painful limb and shift load to their hind limbs. This results in a much reduced force from the DDFT until late stance, when it approaches normal. There is also an additional pressure at the toe during movement, where the load is concentrated on the dorsal hoof wall at breakover. We will see more about this later. These changes are correlated with the unique expression of laminitis in each individual and its severity. Displacement describes the changes in the position of the distal phalanx relative to the external wall. It is commonly described as the presence and magnitude of rotation or vertical displacement, i.e. sinking, of the bone. Digital instability defines the increased kinetic movement of the distal phalanx within the hoof capsule when the foot is loaded. This includes all related structures, not just the bone. Structural failure is variable and often not predictable. Mechanically, the loads applied to the various parts of the foot during this process are translated into tensile, shear, torque and compressive forces as the foot functions biomechanically to redirect, dissipate and absorb the imposed energy. So let's look at the effect of breakover. We know that in the laminitic horse, the maximal loading of the toe region occurs during the breakover phase. We also know that the breakover phase is significantly longer in horses with a long toe, as it acts as a long lever arm, and that the onset of duration of breakover phase are highly dependent on hoof angle and toe length. Therefore, by reducing the length of the toe in a laminitic horse, we can reduce the leverage on the toe and also reduce the direct compression on the toe region of the hoof wall. This will lead to less distortion in the toe region of the hoof capsule. As you would imagine, much of the research focuses on how best to support the foot, as we have seen that this is the structure at risk of mechanical deformation or failure. Several studies show that supporting the sole and frog increases the weight-bearing contact area, decreasing the force required to be borne by the wall and smoothing pressure peaks. A number of different options are available to support the foot, including the Steward clog, as seen here. Note the impression material which supports the whole sole and the raised heel, foam support and frog supportive shoes. For laminitic horses and ponies that are kept barefoot, sand or peat has been shown to be beneficial by providing increased ground sole contact and distributing the forces evenly across the foot. A relatively recent kinetic study from 2019, but which has only just been published in the EVJ in May this year, demonstrated that in both acute and chronic laminitic horses, the vertical force, VF, in the heel region was significantly higher than the toe and middle hoof regions, whereas in sound horses, the vertical force was highest in the toe region. The same study group went on to investigate the effect of heel elevation on breakover phase in horses with laminitis. They found that the breakover phase in laminitic horses with a hoof cast with heel wedge was significantly shorter than those in a barefoot condition. This is because with the dorsal hoof wall more upright, an earlier breakover is elicited. This decreases the load on the inflamed and or damaged lamellae and shifts the centre of force to the heels. They also showed that the total hoof contact area of the heel region was significantly higher in horses with a hoof cast with heel wedge than barefoot horses, which may increase comfort. You can see this in this picture of the foot with the hoof cast on the left has its centre of force distributed more evenly across the foot and more palmally than the same horse in the barefoot state on the right. Therefore, supporting the heel region and involving the sole and frog should be considered when treating laminitic horses for decreasing mechanical load on vulnerable and painful structures. An understanding of biomechanical theory is crucial to understanding this devastating condition. The biomechanics of the equine foot at stance and during movement, as well as the biomechanics of failure, will allow us to apply these theories for clinical benefit. And we have looked at some specific examples in the literature. As a veterinary physiotherapist, our aim is to have a deep understanding of these principles to support our patients, their owners, and communicate well with all the professionals involved, so that we can help support the horse to return to maximal function. These are my references.